phone. Ugly life.
All right. We see people trickling in. So we're going to start in about 30 seconds. Going to allow everyone to join.
I just sent it to you.
Can everybody see my screen okay?
Yes.
Beautiful.
Okay, folks, it is Tuesday morning. It is 8:30 a.m. and that means we are here for another Coffee Chats with Economic Alliance Snohomish County. I am the President and CEO of Economic Alliance Snohomish County. My name is Gary Clark, and I am excited and delighted to have everyone here today to chat with us. We generally do some housekeeping updates, and I'd like to make sure that you're aware of that. We love for you to make sure that you put your name in the chat prior to us diving into conversations so that we know what organization you're with and who you're with as we move forward. And please be engaging, ask questions in the chat. We really want this to be a robust experience where you are able to engage our panelists. Now, just a few opening remarks. In 2021, on this topic, which we're talking about, which is homelessness and recovery solutions, on a single night, more than 326,000 people experienced sheltered homelessness in the United States. 6 in 10 were individuals, that is, people in households with only adults or in households with only children. 4 in 10 were people with families and children. According to 2020, the report for Snohomish County Human Services Department, a point in time, the count of homelessness, people living in the county tallied a total of 1,132 people. This count included people residing in emergency shelters, using transitional housing, and living without shelter. Among Snohomish County, Everett saw the highest population of unsheltered homeless. Today, we're here to better understand the resources available in our region and to hear from our experts about the principal risk factors that have been found to increase vulnerability to homelessness. Now, one small nugget, anyone that you see and may come in contact with, they may be gainfully employed, they may not be, they may be a CEO of an economic development organization who has experienced homelessness. And so I will say, first and foremost, that is my experience and upbringing. Now, with all that in mind, I get to set the stage for some amazing panelists. So first and foremost, Joseph Alonzo, Chief Executive Officer at Cocoon House, is here with us. Joseph, welcome.
Thank you, Gary.
We also have Michael Campbell-Dunnis, Marketing and Development Manager at Bridgeways. Michael, welcome.
Thanks, Gary. Hi, everyone.
And we also have Keith Eisen, and that's the Program Manager for PATH. Keith, welcome.
Thank you. And you pronounced my last name awesome.
All right. All right. And Kate Tillema is MS LMHC and also the Director of Adult Intensive Services, Compass Health. Kay, welcome.
Thank you, and good morning, everyone.
And last but not least on our list of panelists, we may have a few others join us, but we have Brennan Davis, Executive Director at Recovery Cafe. Brennan, welcome.
Good morning, Gary. Thank you.
Well, folks, we're setting the stage here with, and last but not least, I see we have Brad Walser on here as well. Brad, I didn't get a chance to mention you. So let's go ahead and give you a welcome as well. Welcome, Brad. Are you unmuted? Not yet. Oh.
There it is.
There you are.
Yeah.
Okay.
Good morning, everybody.
Thank you, Brad. All right, we're all unmuted and we're ready to dive into this conversation. So first and foremost, I know that we have a few points of interest. And Michael, I don't know if you want to start off, and then we also have another panelist, hold the horses, as we welcome Diane. Angus, Diane, welcome.
Good morning, everyone.
All right. Joe?
Yes.
And Michael, I want to ask that you all just set the tone here before we dive into some initial questions. Let's get some conversation about who you all are. So Joe, I'm going to throw it to you first.
Sure. Thank you, Gary. And thanks everyone for being here and letting me come and represent Cocoon House. As Gary had mentioned, I'm the CEO of Cocoon House, and we work in this community to help young people, families, and the community break the cycle of homelessness through outreach, housing, and prevention strategies. So we're really trying to be upstream of the issue as much as we can. We target individuals under the age of 24 and their connected families who are dealing with, all sorts of impacts and intersects of homelessness. And so we offer about 18 different programs, a variety of different strategies, really to try to address the root causes of what is making our young people in our community become homeless. So I have some slides that you want me to jump into those now, Gary, or okay, perfect. So I'll share a screen and just walk through, but please interrupt me. I love dialogue, not monologue. So bear with me here. Hopefully you can see this.
Yes.
Okay. So as I mentioned, our mission and our vision for the community is that every person is safe and thriving, right? So we kind of do those 18 programs through 5 sort of pipelines of work here at Cocoon House. And the first one is outreach. We began doing outreach back in the late 90s, really trying to get out in the community to let folks know that Cocoon House was a safe place. We kind of started with housing, but we wanted to connect with young people around the community. So we have been doing street outreach to parks, to the streets, all throughout Snohomish County. Schools are a big one, libraries, really just anywhere where young people might congregate to let them know that we're a resource if they or anyone they know are struggling. We also have a 7-day-a-week drop-in center called U-Turn, and we serve a variety of young people can come through U-Turn, everything from getting food or hygiene supplies to getting engaged in recreation, getting into case management. We have medical support, mental health supports on site. We have a music recording studio just as a kind of low stress way of getting engaged, all with the intention of getting folks further invested in their stability and housing. We also offer under 18 housing. This again was sort of how the original Cocoon House was started 30 years ago. We have short-term shelter for youth under the age of 18 up to 21 days. We've offered that in Monroe in a congregate shelter setting. We also have recently launched a host home program where we're placing youth in trained and vetted family homes who might have an extra bedroom for young people to come in. And so that's really a cool model. We also have long-term residential care for youth under 18. They occupy a floor of our building here at the Hub on Colby Avenue. And that's where young people who are not able to be reunified back home can live basically in our programs. We have 24/7 staffing. It's all inclusive. So it involves, food, everything that a family might offer. We do it with professional trained staff. And youth can stay in that program until they turn 18. We partner with Compass Health. We partner with Catholic Community Services just to kind of round out the mental health and chemical dependency supports that young people may need. And community health centers also for physical health needs. We have young adult housing portfolio. This is something that Cocoon House really tried to invest more heavily in over the past several years. We recognize that a lot of our young people, when they were aging out of our housing at 18, actually took a huge step backwards because this notion that once you're 18, you're an adult and think and act like one doesn't always prove to be true, especially when you've experienced a lifelong period of trauma. So we've invested in owning, operating some site-based housing. Again, here at the hub, the 3rd floor is dedicated to young adults under the age of 24 who are learning to develop employment skills and learning to live on a lease for their first time with, again, 24/7 staff available to kind of help them be successful. We also have scattered site rental units around the community that we partner with landlords. We partner with the youth. We help subsidize the rent and rapid rehousing model. And we do that and case manage those young people in those units as well. So it's about 40 units of housing that we offer for young adults as well. And then Cocoon House is also, as I mentioned, heavily invested in trying to prevent homelessness from ever beginning. We believe that's kind of the way we get out of homelessness, is try to prevent it. We have a variety of programs where we provide in-home family case management. So in the event that a family might call and want one of our youth to come into shelter, we'll typically tell the family, hold on a minute, let us come to you. And we'll go into that house and try to figure out what are the root causes of the conflict. What things can we deploy that might help alleviate some of that conflict and keep that family communicating? And again, we offer parenting classes, educational seminars in partnership with Denny Juvenile Justice Center. But we really have identified that some of the root causes of conflict in the home actually don't have anything to do with the youth. It's something like financial stress that leads to just relational conflict. So we work to try to get those families those resources. And then lastly, we have a new youth employment program that's in partnership with Housing Hope, Immigrant and Refugee Services Northwest, and Seattle Jobs Initiative to help do outreach to young people, get them connected to internships and also into employment opportunities, because as we all know, having employment skills and resources is going to be a step out of poverty, which is a very difficult step for many of our young people. Questions so far? No, okay, I'll keep going. I'm trying to make this quick. Just some fun facts. Cocoon House, we operate with about 100 employees around 4 different locations in Snohomish County, 2 in Everett, 1 in Monroe, 1 in Arlington. We also rely on about 20 collaborative partnerships with other providers. So we don't do this alone. Cocoon House and other partners, we're all tools for the community to utilize to address homelessness, but it's not our issue to address. It is entirely a community-wide effort. In 2021, our anti-human trafficking response team, which is embedded in our outreach program that I mentioned, served 52 individuals involved in human trafficking, and we're able to successfully get 81% of those to a safe exited location off the street, which we're proud about. I mentioned U-Turn as the drop-in. During COVID, we had over 500 youth visit and over 7,500 meals and hygiene kits handed out. So get a lot of output still coming through. We house approximately 300 individuals each year. All youth that come into any of our programs set individual goals and compete against their own progress, not against anyone else, in the areas of stable housing, employment, education, life skills, health and well-being, relationships, and community connection. And for those people that are business interested, we have about a $9 million operating budget. We have 45 different public grants and contracts and over 30 private grants. So it's quite a recipe of ingredients to make these organizations work. And I'm sure I'm not the only one that experiences that. So private community support is always super welcomed. And just ways to get involved. Like I said, we rely on these relationships with our partners and community. If you are involved with an organization or corporation that wants to support, having sponsorship of any of these speakers here, any of these organizations sponsoring their work, helping with non-restrictive dollars is something that you'll hear anyone in nonprofit talk about the need. So those types of ways of getting engaged, I think, are always really useful. Attend events. So for us at Cocoon House, our next event is June 1st. It's the Butterfly Celebration, and it is a celebration of milestones that our youth have hit. Very lovely event happening at Angel of the Winds Arena. And then other ways to get involved: host an event. If you have a company party or a company activity where you can invite a speaker, one of us from this panel perhaps, to come and speak to your group about homelessness, about the work, we're always happy to do that. Also hosting drives to raise, things like gift cards or meals or something that are very welcome. Volunteer opportunities, as I mentioned, host homes and families that can open their homes, something that we've been recruiting heavily for and continue to. So if you know a family that would want to take youth in for a short period of time and that would be enriching in that experience, we would love to talk further. And then lastly, just following our work, following social media, following our website. We're trying to keep the community engaged and understanding of the evolution of our work. So we're proud of the work we do. It takes a whole community. We want you to be a part of it. And I will pause there and give it to other folks to talk.
All right, thank you very much. I think that was excellent update, Joe. I want to move it back to our panel visual so everyone can see the group. So we can unshare there. And then, yes, I believe Bridgeways also had a brief update. So Michael, if you wanted to dive in on that, give us a little update, and then we'll make sure that there aren't any other updates, and we'll dive into some Q&A.
Great. Yeah, thanks, Gary. And thanks everyone for attending today and showing your interest and investment in the work, in this work of homelessness. So I'm just going to share screen real quick. Let's see. Sorry, just 1 second. All right, I apologize. I didn't set up the accessibility to share screen yet. So here we go.
Try it one more time. There you go.
Perfect. Is that working for everyone?
Yes, sir.
Okay, so I'll try and keep it pretty brief. And I brought a crew with me to kind of talk about PATH, just because I wanted the folks that are working on the ground floor of these things, doing the work day in and day out to really share their experience. So I'll be real brief with Bridgeways. Bridgeways is a nonprofit employment social enterprise. We were established in 1981, so we've been in the community for about 41 years, serving Snohomish County primarily, but we do work outside of the county occasionally. So we're a mission-driven organization, and that's to provide services that promote quality of life for individuals living with a mental health concern in a manner that facilitates growth, independence, and a sense of community. So we have our clinical side of things, but we also have a contract manufacturing side, and it's in that contract manufacturing that helps to fund those clinical programs. So that's kind of our general model there. Speaking of our programs, we've got several programs that we do. So we're focused. We do have programs focused on homelessness and housing, certainly, but we also have supported employment. We have our MAP court program. Additionally, that's actually not on this slide, is it's modeled similar to the MAP, which stands for Mental Health Alternatives. We have another program, a substance use program that was just approved and passed through City Council in Marysville and in Everett. So we're excited about that. We of course have PATH. We're working on a creative economy supported employment program, which is certainly outside of the folks that we typically reach. So we were excited about that potential. That's very in the early stages. We have an industrial manufacturing technician apprenticeship program through AJAC, which is the Aerospace Joint Apprenticeship Committee. And then we have CBRA, some CBRA funding. So that's community-based rental assistance that provides long-term housing support. So those are a few of our programs. I'll just hand it off to Keith now. So he's our program PATH program manager. We're gonna have Keith talk, and then we're gonna have Diane really briefly and Brad really briefly, and those are both PATH case managers, to just kind of share what PATH is, and how Bridgeways works towards working with the homelessness population and helping those folks. So I'll pass to Keith here.
All right, thank you. So PATH is our outreach program. We've been doing it for about 6 months, so we're fairly new. And it's about going out there, reaching people who have mental health, behavior, substance abuse issues, various disabilities related to that. Also co-occurring mental health and substance use issues, along obviously being homeless. Next, thanks. How do we do it? Well, we again go out there into various encampments and on the street, and we look for people who typically they're either living in their car, encampments, some people floating in and out of shelters, but they don't have housing that's inadequate at best. Sometimes it's like an abandoned house. So we try to connect them to services. We have, we're part of the Snohomish County is a database which tracks who we serve and, you know, how long do we serve, do we assist them in our services as well. We collaborate with various detox and treatment centers, Smoking Point Behavioral Health as well. We try to, essentially I say that we're the middleman, where we take people from the street and see if we can connect them to various services that they need. Mostly that means multiple services though, because people aren't one-dimensional like that. So it takes a lot. We serve families, individuals, veterans. Again, they all a lot of them have co-occurring issues which related to substance abuse and mental health issues. And essentially it's a journey because it does take time to get people into various services. Next. So we do referrals to various, a lot of times it seems as detox and treatment centers, but we also try and see if we can connect people to housing services or case management, which Bridgeways itself has in-house housing and employment services. So if you have Medicaid, then they qualify for our services within Bridgeways. And that's also, again, employment and housing, case management. We don't actually have housing, but we can offer the case management for housing. Again, Veteran Affairs is very key because veterans have a lot more opportunities. There's about a dozen more doors that are open. That's not open to people who had never served. So it's really key if we can get the their discharge paper, which could take 2 months or so, then we can open a lot of doors for them. And we definitely have a lot of networking and that goes on in Snohomish County. As you can see, there's various, there's Volunteers America, LEAD program. Again, there's VA and there's the Carnegie Resource Center. I don't want to forget that we also have a partnership with Providence Hospital, which is big, and Mercy Watch, which is a mobile medical team, and they've gone out with us a dozen times as well, and they give treatment to various people in abandoned houses. They might have frostbite on their hands and their toes, and they have treated them. And we hope to grow that partnership as well so that we can continue to take them and to various locations that we get, and so the people can get treated.
All
Okay.
right.
Yep.
So I'll briefly go through this just because I want to give Diane and Brad an opportunity. You know, at the end of the day, you know, the kind of the community impact that this has, you know, when we're talking to Economic Alliance, we're talking to folks, you know, some of you are elected officials, some of you are obviously private business owners. So, you know, this is the impact that we see that PATH has. You know, one of the main things that it relieves law enforcement to focus on, you know, kind of the more direct, more emergent needs. So we can kind of take on that workload and often do work in tandem with certain law enforcement programs. We also, you know, it provides, you know, supports for those living on the street and in doorways of local businesses. So we're helping, you know, we're helping not just, you know, maybe getting those folks off the street, but we're helping them, you know, work towards you know, a better life, a better quality of life. And more generally, I think, you know, we all want to live in a community that, you know, takes care of its most vulnerable. So that's really what PATH does. And like Keith alluded to, you know, really this is a, you know, the way Bridgeways functions in our clinical services is to provide a holistic kind of comprehensive approach. So, you know, obviously we offer that housing support, but we also offer, you know, employment supports, connection to substance use and mental health services. So it's a multitude of factors that we know that affect these folks. So all right, well, just a couple more slides. We're just gonna have Diane share a quick testimonial and then Brad.
Hi everyone, nice to be with you. I'm going to read the following.
I can't hear you.
Oh, can you hear me? Okay. Hi, this is Diane, and I just wanted to read the following testimonial. This is something close to my heart. I'm privileged to be amongst people and help them to help themselves. We really are about making people be advocates for their own life going forward. And so I'm going to read the following testimony. So can you hear me all? Can you hear me? Okay.
Yep.
So basically, I met Paul. Paul was homeless for 3 months. He did not like the shelter because some people inside were intimidating or violent. And so he spent his nights outside trying to stay warm and his days trying to find resources for more permanent housing. Paul encountered a social worker at the Everett Library, which began his journey receiving social services. We encountered Paul at the Vision Church during our outreach in Everett. As PATH case managers, Brad and I referred Paul to detoxification and inpatient treatment at Smoky Point Behavioral Hospital. When Paul's turn came up to enter treatment, we picked him up and brought him to his inpatient setting. When treatment was over, we secured the HARPS funding for a motel stay and provided Paul with a cell phone and transportation to the Days Inn in Everett, where he stayed for a week. And then during his stay at the motel, we successfully referred Paul to Oxford Sober Living, where he did an interview and it got accepted and where he currently lives. Paul's hard work and dedication to himself is a victory for Paul and just a testament to the effectiveness of PATH. And it's, again, I myself have lived experience. I was homeless, and I know how important it is to find the safety of shelter. And every person every time we help someone, that's a victory for them, and it's just a nice feeling. And it's our passion to be out there every day, encountering people and finding out what their goals are. You know, what do they want to do? And helping them achieve that. So thank you.
Great. All right. And then Brad. I'll Brad share a little bit. You might be muted there, Brad. Got it.
So yeah, we do have challenges out there. Yeah, as this states, you know, these challenges is finding people a place to go. Like, you know, and as a team, we see like the expansion of like diversion housing models and hotel vouchers and et cetera, as an immediate direct way of getting people off the streets. You know, and the increased availability for detox in Snohomish County, because we actually use other resources outside Snohomish County to get to people to detox. We have transported all the way to Oak Harbor for people to detox and stuff like that. And the availability doesn't seem to be here in Snohomish County. We don't contact these people at 8 o'clock in the morning to get them to call for detox that day and be able to get them in a detox center. In most cases, when we contact people and they do the phone intake, I mean, the process goes, and sometimes it's like, like we did one on a Thursday, did the intake, and on Friday took him to Oak Harbor. So the intake process at 8 o'clock in the morning just doesn't seem to work. What happened to our? I don't have a script anymore. No.
May have gotten kicked off there. I apologize.
Yeah, and then obtaining ID and way of contacting these people is, our friends out there, basically. A lot of our time is locating them after we've signed them up, and they migrate. And so if we don't have a phone or any way to contact them, which they need an ID to get a phone. So, I mean, it's a process. So, it doesn't happen overnight, and we're running around trying to find our clients most of the time, and really longer stays in some of these facilities would benefit more substantial recovery. That's what we believe as a PATH team. And the solutions are right there, the advocacy and lobbying for greater, it's all advocacy and lobbying, right here,
Right.
and then the support of the organizations that are doing this. So thank you all.
Right. Well, thanks everyone. We went a little over time, so I apologize for taking too much time. But thanks for listening, and yeah, we appreciate it.
All right. Well, now that we have kind of some engaged information from both Cocoon House and Bridgeways, I'd like to open this up a little bit and dive in.
So I just have
Okay.
a question. We going to go through, I've got just a little bit on Compass Health.
Yes. Let's dive in with Kay's update, and then we'll have a series of questions. But I would ask that those of you in the chat, I know you're chomping at the bit to ask questions. So if you start to throw those in there so we can use this to the best of our ability with the time we have. Thank you, Kay.
Yeah, and I will keep mine brief, but one thing I want to say is my career has always involved working with homeless people. When I first got out of grad school, first job I got was down in Cowlitz County, and I was a case manager in a 100% outreach program, and we didn't have resources there. So it was all about collaboration, creativity, and I think that's something I've seen throughout my career. After that, worked for 10 years with community psychiatric clinic. My two clinics were in Pioneer Square and Belltown, so obviously a huge homeless population there. My specialty has also been with people with severe and persistent psychiatric disorders, and so they have a lot of needs. I've worked now in Compass Health for over 15 years. Compass Health, probably a lot of you know, but it's a large organization serving a 5-county area. We've got a whole range of services, including inpatient psychiatric care, a crisis triage center, residential treatment, outpatient, including intensive outpatient services, which are some of the services I most work with. We have PACT, we have WISE for kids. So it's a whole host of services. I could certainly answer more questions about any of those. We also have a lot of specialty programs. But one thing that I just want to focus on briefly, one of the things that I think, obviously, one of the things most needed by homeless individuals is affordable housing, which is really not out there. I mean, a lot of these, we have these, clean and sober houses. They're not so clean, they're not so sober, and they take most of a person's income for the month. And so it's a real challenge. Compass Health has, over 200 units with subsidized housing, but it's still not enough to meet the need. But one of the programs that we opened up end of last year was Andy's Place, and which has 82 units, and it is supportive housing. So there's 24-hour staff availability, which is great. And then they work in collaboration with, my programs in particular, our PAC program, our intensive outpatient program. So the person gets supportive housing support and support from the intensive programs. And the great thing about this is low barrier housing. People aren't kicked out if they're using substances, et cetera. And so that really helps because, most of you know that if somebody's using, it isn't so easy to just stop. So we try to, address what we can so that the people will succeed in housing. And we have, for example, we have one individual who came out of Western, and it hasn't even been but maybe 8 months, and he's already working and doing really well. We also have a number of clients that they have really severe psychiatric disorders, and even on medications, there's not the right combination that fully stabilizes them, but we provide them a lot of support so that they can stay and maintain their housing. And of course, is, a lot of times there's ups and downs, and it just requires a lot of support. But we've just seen some really good results with that housing. And the other important piece of that is, as some of you know, when you have housing units, a lot of times drug dealers will try to get in, or they will victimize individuals. With Andy's Place, since there's 24-hour staffing, there's much less of that occurs, which helps the people to stabilize. So I don't want to take more time because I want to allow time for questions, but I just wanted to mention that.
Thank you very much. We also have Everett Recovery Cafe with Brennan. And so since everyone else has shared a little bit, Brennan, take the stage.
All right, I'll just go really quick. So you guys know the Recovery Cafe model is a low barrier place for people that are drug and alcohol free to come in and find life transformation and community. Trauma and isolation are kind of those things that pop up on the list that are kind of like those silent killers, right? And I have pictures to show, but I won't because I really want to hear these questions. But that there's a danger to the ups and downs of relapse and the ups and downs of homelessness. It's people be doing really good, and there's a lot of investment in treatment, and there's a window of willingness where they're really looking to get change and really looking to do better in life and reaching out for help. And we love to take advantage of that. But a lot of times after they get help, they start dealing with some of those issues that got them there in the first place. And there's not always that recovery support for them to keep them from crashing. And that's when it's just really, hard and dangerous. And so we have this cafe that's a membership model, bringing people in, and as members, they come to these recovery circles where people that never talked about their struggles or their issues, because maybe they were raised like some of us to never mention what we struggle with, right? They can vocalize it and receive feedback. And then through that peer model, it's kind of like a seesaw, right? Where you start out, everybody needs community. It's a fundamental need. I don't know what kind of community you guys have in your lives, but people that are experiencing homelessness, which has actually, we're finding an uptick. I was just talking with area of homelessness for Snohomish County, and they were saying there's an uptick in people that start out homeless and then become addicts. It's not the other way around, which is kind of a myth, right? So they become addicts to try to deal with some of the trauma of walking the streets and with the cold and the feeling of vulnerability, right? And so we try to, so what'll happen is their seesaw will kind of community will tick this way, and these are unhealthy relationships, right? And this is unhealthy community. And over about 2 years of the National Health Institute will say over 2 years it takes to tilt them this way to where they have a healthy recovery community. And I've seen some of these questions. You know, I know a lot of us are in those health human services groups where we talk about how housing, affordable housing, is the big thing right now. You know, a lot of these homeless we're seeing now are actually, there's an uptick in homeless families, right? Homeless families without affordable housing. And that's kind of, and they are forecasting more evictions on the way as some of the COVID help for landlords goes away. And so they're seeing an uptick in evictions and homeless families needing help. And so all of us as organizations, I think that's for us, we give our members resources like that. And so we're like, hey, what do you need today? Do you need, you know, dental work? Do you need, you know, maybe we're trying to refer them and they're like, we need housing, I need help. I need a place to live and a place to stay. And so this is an issue that is huge for our area. Another myth is I was told that, you know, because we're doing so well, which I know we are in Snohomish County, that homeless are coming from other counties to us. But actually the majority or what we're seeing is that our homeless are our friends and neighbors. They're actually from our area that are losing their housing. And so, you know, for us, our big thing is our front desk. You know, when people come in off the street and they're coming to the Recovery Cafe, maybe for a warm meal, maybe for answers or help or membership, so often they're so used to being turned away. You know, they've gone to several organizations or they've said, hey, they tell them, hey, go and call this and receive these services, but they only have 5% charge on their phone, right? Their phone's about to die. They don't know where to charge it. How are they gonna stay on the line for an hour, right? So these are kind of some of the things that we're all trying to work through in helping our homeless. So yeah, I know I could do a promotional piece for the cafe, but really I would just want to jump in and say Cocoon House and Bridgeways and Compass Health, we're all just trying to combat this huge epidemic.
Okay. Brennan, thank you very much. I'm going to jump right into some rapid fire questions and let's just engage on these. And if you feel like the answer has been answered, we'll move to the next one. And so we can get to some of the questions in the chat as well. But I'll start off with a very simple one, but probably complicated in its response. What helps people break the cycle of homelessness? So if you feel like you want to dive in.
I think housing first models help people with breaking the cycle. You know, it's kind of what's that? Yeah, just housing first models. And I lost the train of thought there, but yeah, getting them housed is actually, I think, a priority.
Thank you. Thank you. Anyone else?
And just another piece is, I think sometimes too, for people that have been homeless for a long time, it's a real culture shift. When they do get housing, you know, they've got to learn a whole new set of skills. They haven't had to maintain a household, et cetera. So that's another piece. You get them into the housing and then providing that support to help them with that culture shift, because culture shift takes time.
Anyone else?
I'll echo housing, but I also think it's important to recognize what Brennan said around that seesaw. These folks that we work with, for all of us, have been through so much trauma that it doesn't change overnight. So you might have multiple attempts at housing that don't go super successful, and like you have to continue to stay engaged with that person to change that network or that pattern of behavior, or you know, their sense of community. It takes time and dedicated commitment from the provider world.
All right. Okay, let's move it along quickly here. I'm going to ask a follow-up question. What programs have shown a level of success and why? What programs have shown a level of success and why?
I don't want to talk too much, but I'll say for young adults in Snohomish County, our rapid rehousing model really works well. We have also a demonstration project that we worked with HUD on to expand upon the rapid rehousing model, which offers 90-day of sort of shelter in place and then into a rapid rehousing situation. But what we find is getting young people into housing, that housing first, is that everyone is saying, and then getting them into job opportunities, job skills development. We find that they're actually pretty resilient to become, start able to save and start to pay more and more of their rent through that period of time. And so just for the young adult population in particular, that rapid rehousing model works really well.
All right. Anyone else want to tackle that answer?
I just kind of look at the diversion program too, as a way of, I mean, you don't think there's some pros and there's some cons, but I used to work for the diversion center here in Everett at one time too, and I think the biggest con is the food, but the pros are is building support around them with support groups like Recovery Cafe type situations like that, where you got people peers modeling peers, so I really like that idea. I also manage recovery housing on my other job. So, and not all of it's good and not all of it is bad. I don't believe in the over two people to a room idea at all. But, recovering living is building a support group around people before it's transitional, it's not meant to be forever. So, and the housing out there, the prices of housing and recovering addicts and people with mental health getting into housing, there's a lot of barriers that they have to go through to get a house, so, working through that stuff with case management and counseling. So
who is most, go ahead, Brennan.
I think, like Brad was saying, I'll just briefly, the recovery model where, a lot of people, they come into in survival mode, unable to function, and I like the recovery model of allowing them to hear themselves and talk about their own goals and then hold them lovingly accountable. Just over time, low barrier, low trauma. We've seen huge success with people going from recovery mode on the freaking out to, okay, I can do this. So.
Thank you.
And I think it's building relationships with clients. We have in our PACT program, we have a lot of success in that way because it operates 365 days a year. We provide, medication monitoring out there, but, just even it takes so much time to engage them. They have to trust you, to even. So I think that's, it's about building relationship. Too.
Well, okay, I have one follow-up question, and then I think we're going to jump to the chat for questions and comments. So please, if you have questions now, we're going to try to get to as many as we can. We'll probably just take one answer from the panel as opposed to multiple, and we'll go from there. So here's a follow-up question is, who is most at risk of becoming homeless? I don't have any Jeopardy music, but I know someone will take the lead on this. Go ahead, Diane. You gotta unmute. Are you muted? We can hardly hear you, Diane. I don't know what. Oh, now I can hear you a little bit.
Okay, all right. So one thing that I think is the behavioral health, mental health issues of people that are homeless, trying to find housing and then keep housing. I like what I like the transitional model, sober living model of wraparound services that was discussed, so that people do have time to breathe, to get connected to services for counseling, ongoing outpatient treatment, intensive outpatient treatment. But I do believe that people with suffering from mental health issues are in dire straits of becoming overwhelmingly homeless or at risk of becoming homeless. And obviously people that are on the street that might have mental illness will often self-medicate. And so that's where we have the co-occurring issue.
Thank you.
So it is an epidemic, and that's my input. Thank you.
Thank you so much. So really quickly, we have quite a few questions in the chat. Again, just try to rapid fire. Whoever feels most apt to answer, we'll take that one answer and we'll move to the next just to get to as many of these. And then we have one, I think, James, one comment that we'll try to get to at the very end, I think. So can you address the lack of housing in our region and how it impacts your work? How do your clients exit your programs and find housing in this market?
Well, it seems like in a recovery house setting, a lot of people, because of the barrier situation and no tolerance situation, exit the housing due to relapse, which is a barrier for maintaining housing and stuff like that. I know. I'm going to be quick about this. With the house I live in, because of my resource ability and stuff like that, and I manage the house, I try to get people to detox and work with them, and it's a 3-strike you're out type thing. It's not a 1-strike you're out. So we actually work with people in a different way than most recovery housing. But as for a path outreach, finding housing like that is difficult.
There's one comment in here, and this might just be for follow-up, but Jennifer asked to Joe, do you have recruitment material and policies you're willing to share regarding the host home component of your work?
I do, and I put my email in the chat, and I would love to share that information with anybody. My email is also on the slide deck if it gets passed out, but we do have material. The training is mapped out, the vetting process is very mapped out, policies, etc. So happy to share with anybody that's interested.
Thank you so much. And then a follow-up from Jane, who asks, what is SNOCO doing to get people off the street with immediate service, staff support, housing, hotel? Is there any answer to that? And then direct it to one of the organizations. What could we do as a community to help? Anyone want to take a stab at that one? What could we do as a community to help?
Well, I think that for me, I have to say that just focusing from the perspective of trauma, you know, like Kay was saying, trying to build relationship. We don't want to, you know, we just want to be aware that a lot of times when we see people struggling on the street, that they are used to having, you know, things slammed in their face, and just really, you know, thinking about just having a plan of action of where to hand them over to, you know. And I think as far as the county goes, I think they're still in the Office of Recovery, you know, is working really hard to try to build back after COVID, and they're reaching out to these amazing organizations to see, hey, what can we do? What are we going to do about this crisis? So I think a lot of it's still in the planning stages, but yeah.
Thanks, Brendan. I really appreciate that. We're running out of time here, but that just means that we have to do this again. So let's look forward to expanding this topic. I do have a question about the encampments that we see on the streets. Is it a capacity issue? Is it money? Is it willingness to help? So one final question, and then each of you, if you can take 30 seconds to kind of do a closing remark after that. We did have a comment from James, which is in the chat, and I don't know if we'll be able to get to you, James, but I really hope that people can access the Dispute Resolution Center that is relaunching a renter certification and fair housing training. So just want to make sure that you all see that. And the DRC mediator is who mentioned that. So let's go ahead and tackle that last question, and then we'll go to closing remarks. Anyone will? Okay, go ahead, Joe.
I'll take a shot at it. And I don't know the answer specifically, but I think that so much trauma happens in the lives of folks that for whatever reason, whether there's a shelter bed available or a housing placement available, sometimes the street feels safer, and it may or may not be, or that community of support is the folks in the tents around you. And so leaving that is really daunting. And so I think that it's easy to judge, but it's not so easy when you're in that situation. And so my closing remark would be humanize this issue, because it's so easy to not look at the person standing on the corner. It's so easy to think that there's someone's problem to deal with. These are people, these are lives. And the more our community works to try to understand the situation and find out what your role in this solution is, I keep saying it, this is not a recovery cafe issue or a cocoon house issue or a Bridgeway issue. It's a community issue, and we all need to play a role in it.
Thank you, Joe. With that message from Cocoon House, let's go with closing remarks from each of your organizations. Brad, it sounds like you're trying to speak. Go ahead, jump in there.
I love what Joe said and with Cocoon House there. And, you know, as Bridgeways, we keep showing up. I mean, we just keep showing up and treating people like people. And it's not, you know, I don't preach out there getting off drugs or anything like that. I'm trying to preach quality of life. And how do we get you quality of life?
Awesome.
And then show up and keep showing up. When you say you're going to be there, be there.
Thank you, Brad. Anyone else with closing remarks? Michael?
Yeah.
Go ahead, Keith.
Okay. Yeah, I just want to echo that treating people like people is very key. It builds the rapport. It allows people to trust you. And it opens doors to them relaxing and then saying, okay, I trust this person. I'm ready to go on this journey to get help.
Okay, I really appreciate that, Keith. Let's give everybody a chance. Kay, do you have any closing remarks?
I would agree. I think it's a community issue, involves collaboration. And I also agree with it is so important to see these folks as individuals. You know, like, well, why don't they just get a job? Well, most of us don't make change even in our lives that easily. And there's complex issues, there's trauma, there's all kinds of things that happen. So yeah, I think it's, you know, we just all need to keep moving forward to try to address this issue together.
Thank you, Kay. And Compass Health. Let's see, Brennan, did you want to give closing remarks?
Sure. So within the 30 seconds, I'm going to steal an illustration, but they were talking about this issue with me, and they said, imagine you took 20 people and you said, hey, you're going to get from Mexico to Seattle. You have to get, and you only have this certain amount of time, right? But you all have to get there. You know, some people that are in a really healthy place are going to say, he didn't say I couldn't take a plane, right? I'll just take a plane, I'll be there tomorrow. But other people are going to say, oh man, that's so far. You know, how am I going to get that far? You know, depending on their mentality and their upbringing, their financial situation, whatever, whether they're a family, you know, and they've a big group of them, and it could seem insurmountable to them. And so I totally agree with everyone said, you know, trying to take away the stigma and see real people, especially as housing goes up and so many of these people that are losing their houses, they have stable jobs, you know, they're working, they're hustling, it's not like they were just kind of sitting around and found out they were homeless. And so as we humanize them, we take away the stigma, we go that extra mile as a community to take care of them. And like our founder said, you know, we're hoping that Everett and cities around us become some of the first cities that learn how to take care of their people, right? That's our heart.
Thank you. All right. I don't see any other hands raised for closing remarks. Michael, did you have any final thoughts?
I would just second what everyone else said. I don't know that I could say it any better. So yeah.
Thank you. Well, folks, this has been a robust conversation about homelessness, but it's really about our quality of life and the advancement of everyone here in Snohomish County and this whole entire region. And so this is about people's lives and the American way, the things that we all look for, that American dream. And so making sure that we all have an opportunity to have that dream come to fruition. So I want to thank our panelists from Bridgeway, Cocoon House, Compass Health, Everett Recovery Cafe, which is a nice place if you haven't been there. And I want to thank Keith, Brad, and Diane for adding support roles here and giving some real good context. Folks, we do have one update we have, and then I want to make sure our panelists stay on just a little bit longer too. I just want to give a few notes that I'm required to give as Annette is telling me. We are looking at April 12th, a look at housing trends, needs, and innovation. So if you like this topic, you're going to love the next one as well, 8:30 a.m. And additionally, we want to also highlight April 27th. That's right. It's our economic forecast and annual meeting, and we're providing and presenting information about our efforts in the last year, but also we have the amazing entrepreneur and technology advanced guru, Marita Chang, who will be our keynote speaker. So if you haven't signed up, have an opportunity to do that. We also have our economic forecast by Annalise Vance Sherman, who's a PhD and regional labor economist. And we also are going to provide 4 awards to 4 recipients who have done exemplary work and service in our community. So again, please join us for that. Now, let's do our desired choice of coffee and beverage for this morning. Let's open it up to the full gallery so that everyone can have an opportunity to share in this space. If you haven't seen our full gallery, we'll try to move to that. I'm just going to switch to mine. Folks, this has been an amazing conversation. If you can go to screen, let's see your coffee or water or what have you. And remember that Snohomish County and our efforts, they are all tied to you all doing amazing work. So we really appreciate you. Remember that we can make a change together. So thank you for joining us today. Economic Alliance, Snohomish County. Take care.